Welcome back. I'm lucky to have Dr. Jay Heintz, chiropractic owner of League City Spine and Sports, here with me today. Dr. Heintz is a chiropractor with board certification in sports medicine. He's a certified chiropractic sports practitioner. He taught at the Texas Chiropractic School from 2005 to 2011, and he's on staff and the treating chiropractor with the Houston Dynamo since 2011. He's also whiplash and brain injury traumatology graduate of 2014. He's also dry needling certified, and I'm happy to introduce him as I'm the medical director of his office, League City Spine and Sports in League City, Texas. So, Dr. Heintz, tell me about your current practice and then about the Houston Solutions Network.
So thanks for having me. Our office is a medically integrated chiropractic clinic. So we have nurse practitioners, we have chiropractors. Dr. Manzi actually comes in and does consults on pain management for our patients. So the advantage there is that we try to help our patients not get lost. We try to give them all the options that medicine has for non-surgical care in one spot. I'm also the medical director of a group called Houston Injury Solutions Network. And what that group is a group that basically pulls our resources to help become better educated on how to handle auto trauma. Unfortunately, in Houston, auto trauma is a very common thing, and very few doctors are confident enough and trained well enough to handle those cases. So we work with providers across many specialties to give our patients the best care possible.
Great. So can you tell me, HISN, the Houston Injury Solution Network, can you tell me a little more about some of the specialized technology that you have available, like the digital x-rays, to help patients be diagnosed properly as well?
Sure. So HISN has about 70 providers, and they have a huge number of specialties. And within that 70 providers, we've got lots of different treatments that help explain things that are otherwise unexplainable. So for example, one of the things that unfortunately can happen in an auto injury is a permanent slippage or a tearing of the vertebra, where the vertebrae slide in the neck or in the low back more than they should compared to an average person. The only way to see that is to shoot digital flexion extension views and then take those views and digitally render them with software to look for that injury. And why this is so important is if a patient has this, it really changes their prognosis. So we need to be able to communicate that well, and then that way we can give the patient a better understanding of what they're gonna have to work with as far as the long-term prognosis of their injury.
Thank you, Dr. Heintz. I really have had great benefit from working with you and the other docs in the HISN group. It's great to have that network, to have people to refer to when treating these car accidents, and having the availability of all these different specialties under one umbrella so patients can get the right care that they need. Can you tell us a little bit about why do we see a greater amount of soft tissue injuries and collisions today versus 25 to 30 years ago?
Sure. So one of the things that I ask my patients occasionally, especially when they're struggling to understand how they got so hurt, is I'll say, okay, well, if you had a choice between being in a 57 Chevy Impala versus a 2021 Impala, pick your car. And 10 times out of 10, the patient goes 57, because it's a big old chunk of steel, right? But in reality, about 25, 30 years ago, the United States made this great idea. We're like, hey, we want less people to die in car accidents. So what they did is they really stiffened the cars up so that the body of the car is very much like a NASCAR car. So it's designed not to crumble, not to let the cab come in on the person. But one of the rules of physics says that force is always maintained. So if that crumbling effect is not occurring, that force is now getting transferred to the occupant. So what we have is less fatality, less people dying, but more people getting injured. And it's a trade-off. It's a good trade-off. But unfortunately, there's a greater amount of soft tissue and disc injury and facet injury than we've ever seen in cars previously.
Wow, that's pretty dramatic. So how are the auto collisions like sports injuries then?
So the way I look at it is trauma is trauma. So people who think and treat traumatic patients have a better idea of what we're dealing with, and usually it just means a bigger injury. Very routinely as a chiropractor, we have a patient who walks in and their neck hurts because they woke up from pain. Waking up because you slept through the signal to turn your neck is usually a very quickly resolving pain versus whiplash, which can take months and require a lot more specialized treatment.
Interesting. Yeah, it's definitely a challenge. So, our goal is to get these patients treated as soon as possible, so that way their injury doesn't become chronic. I know sometimes the insurance company tells people, I couldn't be hurt because the impact was minimal. Why do some people hurt so much when there was hardly any trauma or damage to their vehicle?
So that goes back to the comment we were making earlier about the changing cars. These cars don't have that crumble factor like they used to. So a very, very small impact can cause a significant injury. You mentioned earlier about some of the advanced training I have in auto physics, and that professor, or the person who taught that was a guy named Dr. Art Cross. And Dr. Cross used to actually put people in cars and strap on all this monitoring equipment, and they would physically just push the cars, like the engines weren't even running. So, you would think that with the engine not being running and physically humans pushing the car into a wall or into another vehicle, that the amount of injury wouldn't be that great. Well, when they got the preliminary data, they shut down the experiments because they realized that they were causing long-term damage to the people who were volunteering for the studies. So it can happen that in a very, very low impact, because the car is not crumbling, all that force transfers up to the occupant and the injury is significant.
Wow. I've heard, another analogy of eggs. When you're driving home from the store, and you have these eggs in a crate, and sometimes when you get home they're crushed. So it's kind of the same scenario in that situation, where there's really not much force or trauma, but with this high speed, and maybe if you stop short on the way home from the store, something like that, you can actually have these eggshells crush on the way home. And that can happen to our soft tissues as well.
Correct, and it also depends on the person. So just looking at the screen, if you look at your neck versus my neck, statistically speaking, women are at higher risk for auto injury and whiplash than our males. And it's just a body. It's sure mass, or sheer mass, that's what I should say. So certain people are at higher risk. Splendor females, especially seniors, significantly higher risk than, say, a 20-year-old linebacker.
Yeah, I can see the difference just looking at ourselves on the screen here. And I can imagine, some little old lady who has some arthritis already in her neck, and then she gets in a car accident. I mean, even though she had arthritis and didn't hurt before the accident, after the accident, it might be so severe because of the pre-existing arthritis, and then the ligaments and joints and discs can, be compromised just from aging. But then when they're subject to trauma, it can be even worse.
It makes the recovery from those injuries a lot more challenging. So, back to, if we think about the example that you gave, most people, and I tell patients this all the time, in the old days, chiropractors shot x-rays on everybody that walked in the door, and we're now being advised that that's not probably the best practice. And the reason is because we're not 2020 model cars. So if we get a 40, 50, 60-year-old person that walks in, they're going to have arthritis. We know that. It's not necessarily, the x-ray is not necessarily going to change our treatment program. However, if you superimpose that arthritis on a collision, and now there's trauma to a less than ideal joint, it does take a lot longer and frequently requires more invasive medical care to resolve the injury than would a young, healthy, non-arthritic person, even though the patient was pain-free the day before they got in the accident.
Wow, that really does make sense now. I know a lot of the frustrations we find too when treating these patients is, when we see people, they're like, my primary care wouldn't see me. they just didn't want to help me, even though I was in this terrible car accident and I need some kind of medicine to get through this. Why do you see mostly the primary cares deny care when people are in a car accident?
It unfortunately comes down to insurance and protocol. So you have to think your primary care, their normal thing is dealing with major medical insurance, Medicare, those types of insurances, and they're dealing with a vast array of injury. When it comes to auto injury, many times the major medical insurance will deny coverage. They'll say, hey, this wasn't us. This was somebody else's fault. It falls under a different policy. And since that isn't where most primary care physicians specialize, unfortunately, frequently the patient is told, we're sorry, you're going to have to treat elsewhere. The issue is they're not typically told where else to go. They just say somewhere else, not somewhere else but here. And that was one of the things that we tried to develop with HISN is we actually have a zip code locator of providers who are willing to treat people regardless of how they're injured. Dr. Manzi and I are both of the opinion that we don't discriminate against patients from how they're injured. We just want to help them get better. So if you go to our website, you can actually go to the zip code locator and find a provider who is very well trained and knows how to handle these situations and can guide the patient both in the medical side, which is the most important thing, but also can help them navigate the insurance waters.
Yeah, I definitely find that in my patients, especially because they're already established with me as a pain management physician. If they're in a car accident and then they come to my office, of course I'm going to help them. Of course I'm going to help them navigate the waters of, being in an accident and how we can prevent this from being an ongoing problem for the rest of their life. We want to address the injury immediately, and more than happy to help them initially from the injury, help guide their treatment through their chiropractic care, physical therapy, if they need medications, and possibly even injections to help the pain after an accident. When I go talk to other primary cares too, I really try to educate them and say, I know you might not want to be involved in your patient's care, but I'm more than happy to help you. And I do offer the HISN website. And if they're close to me, I'm always happy to quarterback that patient's care, so that way they can get what they need in a timely manner. We definitely, again, like you said, we really want our patients just to get better. And again, we don't discriminate on the way they're injured. If they have an injury, we treat it. So let's talk about the type of providers that typically make up the medical team for these auto injury cases.
So typically, like you just mentioned that you will be willing to quarterback. That's rare that a specialist is willing to quarterback. So usually the quarterback is going to be primary care or chiropractic. And the reason behind that is access. So classically in our office, we can get patients in the same day. The higher you go up the specialty chain, usually the further out they're booked. So sometimes the patient has to wait unnecessarily. So usually it starts there. The initial exam is to rule out what we call red flags. So like, is there immediate need for an MRI or a trip to the emergency room or something that has to happen right there? Once we rule out the red flags, we propose a course of treatment that's usually both conservative and medical. So medication plus conservative care chiropractic that usually runs for a period of time to see how the patient responds. Ideally, during that time, the patient gets 100% better, they're done. Very frequently, the patient comes in with 6, 7 things wrong, and we'll whittle that list down to 2 or 3, but we've got 2 or 3 that are being a little resistant. At that point, we usually get advanced imaging, usually in the form of MRI, and then an appropriate referral is made. So the referral will be based on what the MRI tells us. So if it's a disc herniation or a facet injury, it would go to an interventional pain management specialist like Dr. Manzi. If it's a shoulder or a knee, it will go to an orthopedic surgeon. If it's a brain trauma, it would typically go to neurosurgery. So we just let the image and the injury guide the referral process.
Definitely, and I'm really proud to be part of this network to help patients get better. Being board certified in electrodiagnostic medicine as well as pain medicine, I'm able to provide the diagnostic treatments with nerve studies for any kind of numbness, tingling that might be coming from the spine or the wrist, to diagnose carpal tunnel versus a pinched nerve from the neck or the back down to the toes or hands. And then from a pain management standpoint, if the patients just don't get better with their typical conservative care, I really sometimes have to evaluate them more seriously for specialized injections into the joints or over the nerves that are caused from disc herniations and or whiplash type injuries.
So you mentioned the electrodiagnostic studies. One of the things that we found, and again, we've already discussed, Dr. Manzi is our medical director because we really wanted, we begged her to come be our medical director. But when she does an electrodiagnostic study, it's a little different than when we've ordered from other people, because historically there's a tech and they capture the data that goes up into a cloud and it's read by a doctor, but the doctor's not in front of the patient. She actually performs her own tests and does the readings herself. So she's got one-on-one contact with the patient, and we find that the false negative on those tests goes down just substantially. So we get a lot better data having the physician perform the test than having a tech perform the test and the physician not be present in the room.
Yeah, being part of the Electrodiagnostic Society and being board certified in electrodiagnostics, I try to do what's best for the patient as if that patient was my cousin, my brother, my sister, my aunt, my uncle, my mom, or my dad. I really want them to have the best treatment. And I've found performing the study myself doesn't take much more time. And the patients get the diagnosis that's medically necessary and the treatment that's deemed appropriate from those tests. So I do enjoy doing the electrodiagnostic studies, and it's been great to be part of League City Spine and Sports Medicine in League City as the medical director to allow greater access to these patients. And we do accept, referrals from any other doctors that are willing and needing their patients to be treated and worked up properly. So let me talk a little bit about your actual practice, League City Spine and Sports. As the medical director, I'm overseeing 2 of their nurse practitioners that do well care and medical weight loss. Can you tell me a little bit about them and how that's incorporated into a chiropractic office?
So absolutely, because we deal so much so the way we describe our practice is if you have musculoskeletal issues, challenges that are not responding, and you don't need surgery, that's where we fall in. So in the old days, the chiropractors were like, hey, don't go see the medical doctor, and the medical doctor's like, don't go see the chiropractor. And actually now the American Medical Association says, hey, if you have mechanical back pain, so back pain, inside the back, that the first referral should be to chiropractic. But there are many times when the patient comes in and they're just in too much pain and they need something to get them there faster. So what our nurse practitioners typically do is, if the patient's in extreme pain, is they'll do things like trigger point injections, or they'll do an injection into the glute to just drop that pain level down so that we can be more successful with our job. A lot of times in physical pain, weight is a huge issue, especially here in Houston. So it's something we all struggle with. My high school nickname was Skinny. It wasn't a compliment. So it's something we're all dealing with. And, historically, we always approach from the chiropractic side just straight diet, nutrition, which works, but it's hard, especially as we get older. So what our nurse practitioners do is they kind of bridge the gap there, and they can help the patient with medication if necessary, but then really get to the diet and nutrition and the underlying cause of the inflammation so that they have an exit strategy from the medical weight loss. And that's what makes me really proud of that program, is that we are trying from day one to get fired. We want to allow the patient to achieve their goal, but then have a strategy where they're not dependent upon our team. The other part of that is bioidentical hormones. So the nurse practitioners, again, I'm a chiropractor, so this isn't my part of the practice. This is the part of the practice that Dr. Manzi actually directs. But our nurse practitioners can evaluate people hormonally to see if the hormones are the reason that they're not succeeding in achieving their goals. So, the way I tease patients is, we know statistically speaking that we're going to live longer than mom and dad, but the 20 years we're buying aren't really great. And this generation that's now in their 40s and 50s has an opportunity to try to cheat father time a little bit to feel better, to get better gains out of their out of the time that they spend in a gym, out of the time that they spend on their diet, to just be more vibrant by exploring the option of hormone replacement therapy.
Yeah, it's been great working with them and going to the training together with them. You know, obesity is rampant. You know, over 40% of the American country is obese. It's a scary number. And it is a hormone disease. It's a disease related to hormone imbalances. And the fact that we could now tweak those and allow patients to run a clean engine in their car, in their body, and help with the weight loss. Because again, long term, you know, we're living longer and we need to be healthier to take care of what we need to take care of. You know, that's my goal for this show, is to educate people on how they can keep their business running, keep themselves running. And, you know, living longer and being healthy is a huge part of it. And we're just here trying to educate everybody. But to be fired is actually a compliment. Once these patients reach that level, they don't need us anymore. We've done our job. And then they can tell their friends and family and then refer them over, and we'll get them treated just the same way, you know, with all the care and compassion that they deserve.
It's a very common thing that we hear. You know, patient walks in, she's late 40s, early 50s, and just is like, you know, I know I've been told like this is as good as it's gonna get. And that's not the case in modern medicine. Don't get me wrong, they typically have diet things they need to work on. They have exercise things they need to work on, and we're gonna point those out. But when they're hormonally in the tank, or adrenally in the tank, as we call it, it just makes an unfair playing field for them. So they're fighting an uphill battle, and that's not necessary any longer. There's ways around that, and then all of a sudden, the things that they tried 2, 3, 4 years ago work. So there are ways around it, and the patients can, you know, lose that weight, gain that muscle mass, and that's a big thing. If we can encourage patients to increase their muscle mass, we know that they're going to lead longer and healthier lives, just by being stronger.
Absolutely. You know, the recommendations are now, you know, at least 2 to 3 times a week of strength training. And it doesn't have to be heavy weights. You don't have to be a weightlifter to do strength training. There's just basic exercises that can be done, providing resistance, you know, and if it's just where you need to start, you know, that's where, you know, your office comes into play, and other chiropractic and therapy offices can come into play to help patients learn the ropes. Do I just need to start with an exercise band, or even body weight? You don't need to be pushing metal up and down in order to strength train. And I think there's a big misunderstanding about that. But that helps the metabolism tremendously, and I'm a huge proponent of it. You know, I've been lifting weights since I was 14, and, you know, it's been a long time, and I enjoy it. But some people don't. And if we can just educate and provide them with fun ways to incorporate that into their lifestyle, we're on the right path.
Yeah. And that's a big thing, is finding the thing that they like. There's so many ways to be physically active and fit that there's not a perfect. We know that there should be some endurance, there should be some cardiovascular, there should be some weightlifting, and there definitely should be some flexibility. So in our office, we generally tend to have to get our guys to become more flexible and our females to focus more on the weights, because that's the corners that they like to train into.
Yeah, it's so true. I know a lot of people, females that I see, they're like, oh, I really like my Pilates class. And Pilates is great. I mean, you're getting some resistance with band type activities, but it's not the same as actually, you know, potentially lifting heavier weights. But it's a great bridge to, you know, bridge the gap on, you know, getting into something you enjoy. And hey, if Pilates is what you enjoy, that's, at least you're getting some resistance training. But muscle is muscle, and the length of the muscles, the length of your muscle and the length of my muscle are independent of our bodies. And, you know, there's certain exercises that aren't necessarily going to change the shape of your muscle or lengthen them. It's just all about loading the muscle so your ligaments can be put at a stressful force, which then allows your bones to be built. And that's also where the hormone therapy comes into play. You know, we are able to, you know, treat osteoporosis there's just so many amazing benefits of the hormone therapy with regards to the weight loss and the overall wellness of bone health, cardiac health. And, to have a whole team behind the care of these patients, it's just really cool. I love working with your nurse practitioners and your office, and, you have 3 other chiros in your office as well. So it's a good orchestra for patients to get the care that they need.
You mentioned earlier, we've been on staff with the Dynamo since 2011 and the Dash pretty much since inception. And we've tried to model our team very much like the medical team that we work with at those events. When we go into those events, there are specialists for almost anything you can think of. And each person contributes a piece. And the professional athlete wins. So we try to do the same thing in our office where we've got multiple specialists thinking about the same thing. We're constantly going into each other's offices saying, hey, I've got this challenging case, or hey, what do I do? When Dr. Manzi comes in, I typically have a list of 3 or 4 people that I'm like, hey, I'm worried about this. How would you do this? So the patient is getting, unfortunately, especially in my profession in chiropractic was always practiced in a little box, but with one person at a time. And medicine in a vacuum to me is scary. I really love medicine in an environment where there's collaboration and thought, and even every person on our team knows that, like, all of our MAs and CAs, so all of our assistants know, like, if you've got an idea for anybody, bring it up. We want to do what's best for the patient, and everybody check their ego at the door so patients get better faster.
Awesome. Well, I'm really happy to be part of your team, and I really enjoy working with you guys. Thank you so much for being here. Again, Dr. Jay Heintz with League City Spine and Sports, and I'm Dr. Suzanne Manzi with Performance Pain and Sports Medicine. Feel free to reach out to us. We're happy to help. This is Pain Diaries. We'll be back from a commercial break shortly.